Hey future nurses, long time no see. I have been MIA working on a peak. Come on babes, let's not do that. I have been MIA working on our newest addition to the Nursing School Jewels website, the virtual hospital. Today I'm going to give you guys a walkthrough on how to use the virtual hospital. Right now we are accepting people on the wait list to access the virtual hospital, but today I just want to show you guys how it works, how to use it, and I will show you guys how to use our quiz bank, our newest addition to the website as well. If you've been following us for a while, you already know that we post practice questions pretty much every other day. Monday, Wednesday, Friday are the days I like to select. And we typically share our answers on our website. Now we actually have like a quiz format that gives you the answer plus the rationale, and it's all within the website, and it just makes everything just smoother and easier for students to access. So let's go ahead and look at this virtual hospital. Again, if you are new here, make sure you go ahead and like and subscribe, and make sure you head over to nursingschooljewels.com to get your first freebie. When you access our website from our desktop view, you do get access to a little bit more of our resources compared to what you may get access to on our mobile view. So I definitely suggest, if you've been looking at our website from your phone, definitely just go ahead and sit down on a computer and log in and check out the free resources. Also, to access the virtual hospital, also our free case studies, as well as the free quiz bank, you will click on the free resources tab. We are going to click on NSJ Hospital. All right, first it brings you to our patient list. So these are the patients that are available for you to review in the Nursing School Jewels Hospital currently. If you are a part of the subscription, you will have a larger variety. For the free trial version, you are limited to how many patients you will have to access. I'm just going to go to the first patient's chart, Maria. As you see, you have the return of patients list, you have the clock out, and just, of course, a reminder that this is a trial option. Also, you have a little portion where it shows who signed in. If you are actually logged in, it'll have your name, RN. You have a little synopsis about the patient across the top of the screen, and also under the patient's image. You have just stuff such as a provider, allergies, emergency contacts, just trying to make it somewhat realistic as possible, even though, again, this is not as complex as a real charting system. But as you can see, we have the summary, which gives you your chief complaint, medical history, home medications, vital signs, notes from providers, nurses, other events that may have occurred. And right now, for every timestamp, you're only going to have one provider note and one nurse's note. As I begin to build out the hospital, I will make it a little bit more complex. But right now, for every timestamp, you will have at least one note. Then you have the provider's orders. And then you have lab results. And on the orders, again, these aren't orders for you to enact or anything. These are orders just for you to take note of. And as you go through the case study, you will get a better understanding of why these orders were enacted or why these orders were placed. And as you go through each timestamp, you have follow-up questions, and you simply just click the answer that's blurred. Again, with each timestamp, the main things that are going to be changing are, of course, the vital signs, notes, orders, and any labs or diagnostics. Again, with each timestamp, you have those follow-up questions where you simply click to reveal those answers. With every patient that you choose, there will be 3 timestamps that takes you through the scenario. Maybe it be the patient having a new diagnosis and progressing, or having a new diagnosis and declining. Again, here you are back at the patient's list. And once you're done, you just press clock out and it'll take you back to our home page. And again, to access all of that, you go to our free resources tab. Now let's take a look at the free quiz bank. With the free quiz bank, you have access to the daily practice questions, or I should say weekly practice questions that we post on our page Monday, Wednesday, and Friday. This page will give you the answer to those practice questions with the rationales. Just grab the ID number from the top of the practice question post and come and locate it here on the free quiz bank. Of course, these practice questions will be the 3 practice questions that have been posted for that week. And you simply go through, click your answers, and at the end, you press submit, and it will give you your grade at the top of the page. Again, these are completely free to use. You can take them as many times as you would like. They will be open in there indefinitely. Thank you guys again. Make sure you like and subscribe and let me know what other topics you guys want me to cover. Also, if you are getting ready to enter nursing school and you are taking your TEAS exam, make sure you use our code NSJ01 for 20% off of your TEAS study guide. I'll see y'all later.